In the field of sexual and reproductive health, many infections are well known to the public, such as chlamydia, gonorrhea, and syphilis. However, there exists a group of lesser-known but clinically significant bacterial infections that can compromise genital and reproductive health. One of these is Prevotella genital infection. Prevotella is a genus of anaerobic, gram-negative bacteria that normally exist in the human oral cavity, gastrointestinal tract, and lower genital tract. Under normal circumstances, these bacteria coexist harmlessly with other microbiota. However, when the balance of normal flora is disrupted, Prevotella species can become opportunistic pathogens, causing infections in the genital tract, pelvic region, and reproductive system. In this WUTNews in-depth video, we explore everything you need to know about Prevotella genital infection, including the history and scientific discovery of Prevotella, how the infection develops in the genital tract, symptoms in men and women, risk factors and global prevalence, modes of transmission, diagnosis and laboratory testing, treatment methods, prevention strategies, and protective measures. This information is vital because early detection and intervention can prevent complications such as pelvic inflammatory disease, abscess formation, infertility, and systemic infections. Subscribe to WUTNews for trustworthy information on sexual health, rare infections, medical education, and global health awareness. Understanding Prevotella bacteria. Prevotella is a genus of strict anaerobic, gram-negative bacilli. Prevotella species are naturally present in the mouth, gut, and vaginal or penile microbiota, where they typically play a role in maintaining microbial balance. Some clinically important species include Prevotella bivia, Prevotella dissecans, Prevotella melanogenica. These bacteria are normally harmless but can cause infection when normal microbiota is disrupted, local tissue becomes vulnerable, host immunity is weakened. In the genital tract, Prevotella species are often associated with bacterial vaginosis, pelvic inflammatory disease or PID, postpartum infections, and post-surgical complications. Historical background. Prevotella species were initially identified in the 1930s and 1940s as part of studies on anaerobic bacterial infections. Initially, they were mostly associated with oral and dental infections, such as periodontitis and gingivitis. By the 1960s, researchers began detecting Prevotella in urogenital infections, especially in women with bacterial vaginosis and postpartum infections. Over time, studies highlighted Prevotella's role in pelvic inflammatory disease and opportunistic genital infections. Despite this, Prevotella genital infections remain underdiagnosed because the bacteria are strict anaerobes, which makes laboratory culture challenging. How Prevotella causes genital infection. Prevotella genital infection occurs when the natural balance of microbiota in the genital tract is disrupted, allowing the bacteria to overgrow. This disruption can lead to inflammation, tissue invasion, and symptomatic infection. Triggering factors. Antibiotic use disrupting normal flora, hormonal changes during pregnancy or menopause, poor genital hygiene, immunosuppression, HIV, chronic illness, childbirth or postpartum complications, gynecological or urological surgical procedures. When any of these conditions are present, Prevotella bacteria can multiply and cause local or systemic infection. Transmission. Prevotella genital infections are generally opportunistic rather than strictly sexually transmitted, but sexual activity can contribute indirectly by altering the balance of genital microbiota, causing minor trauma to genital tissues, increasing the risk of bacterial migration. Direct sexual transmission is rare, but poor hygiene, contaminated instruments, or untreated concurrent infections may increase the likelihood of infection. Symptoms of Prevotella genital infection. Symptoms vary depending on gender, severity, and whether the infection has spread beyond the genital tract. General symptoms: foul-smelling genital discharge, redness and swelling, pain or burning sensation during urination, lower abdominal or pelvic discomfort, fever and severe infections. Symptoms in women: vaginal discharge with unusual odor or color, pelvic pain, painful intercourse, complications such as bacterial vaginosis and PID. Symptoms in men: urethral discomfort or irritation, mild discharge, pain or pressure in the genital region. Many individuals may remain asymptomatic, which allows the infection to progress silently. Complications of untreated infection. If left untreated, Prevotella genital infections can lead to pelvic inflammatory disease in women, infertility or pregnancy complications, abscesses in the genital or pelvic region, chronic genital discomfort, rarely systemic infection if bacteria enter the bloodstream. Early diagnosis and treatment are critical to avoid these serious outcomes. Global prevalence. Prevotella genital infections are reported worldwide, with higher recognition in regions that have advanced microbiological testing, high prevalence of bacterial vaginosis or reproductive tract infections, limited access to genital health care. Developed countries may report more cases due to better diagnostic capabilities, while underreporting is common in developing regions. Diagnosis. Diagnosis involves patient history and clinical examination, microbiological cultures under strict anaerobic conditions, microscopy to identify bacterial morphology, imaging for suspected abscesses or severe pelvic infections. Because Prevotella is anaerobic, laboratory identification is challenging, and infections are often diagnosed indirectly via symptoms and co-infections.
Treatment options. Treatment focuses on antibiotics effective against anaerobic bacteria, such as metronidazole, clindamycin, combination therapy with beta-lactam inhibitors. In severe cases, surgical drainage of abscesses may be necessary. Restoring healthy genital microbiota and addressing underlying conditions is essential for prevention of recurrence. Prevention strategies. Preventing Prevotella genital infection involves maintaining genital health and reducing risk factors. Practice good genital hygiene. Avoid unnecessary antibiotics. Safe sexual practices. Routine gynecological and urological checkups. Support immune health with a balanced diet, exercise, and stress management. Awareness is crucial because many infections are asymptomatic and can progress silently. Why awareness matters. Prevotella genital infection, though not as well known as chlamydia or gonorrhea, is a potential threat to reproductive and genital health. Awareness allows individuals to recognize early symptoms, seek timely medical care, protect reproductive and pelvic health, prevent chronic complications. Final words from WUTNews. Prevotella genital infection may be rare and under-recognized, but it is important to understand its causes, symptoms, and prevention strategies. Education empowers individuals to take preventative measures and seek treatment early. Subscribe to WUTNews for regular updates on sexual and reproductive health, rare genital infections, STIs and STDs, global health awareness, medical education. Like, share, and comment to help others protect their reproductive health. Stay informed and stay safe with WUTNews.